Got post-heart attack depression? Stop smoking and do exercise. Depression is almost 3 times more common in people who had a heart attack. Some have chronic depression which start before their heart attack, while others become depressed as an acute reaction to the hospitalisation in the event. Depressive symptoms in cardiac patients often differ from those of psychiatric patients. Frequently they don't say they feel sad or hopeless but instead complain of insomnia, fatigue or body pain. The different clinical presentation contributes to the underdiagnosis of depression in cardiac patients. Depression after a heart attack can lead to poor adherence to treatment, skipping medical appointments, smoking, sedentary lifestyle, unhealthy diet, social isolation, and poor self-esteem. Patients who are depressed after a heart attack have a twofold risk of having another heart attack or dying compared to those who are not depressed. The behavioral changes associated with depression may be partly responsible for the worse outcomes in heart attack patients who are depressed. Biological mechanisms, including changes to the autonomic nervous system and inflammatory factors, and decreased heart rate variability, may also play a role. Exercise and stopping smoking improve depression after heart attack. Cardiac rehabilitation with aerobic exercise can reduce depressive symptoms and improve cardiovascular fitness. Dr. David Nanchin, head of the Prevention Center, Department of Ambulatory Care and Community Medicine, University of Lausanne, Switzerland, studied 1,164 patients, who were part of the Swiss acute coronary syndromes cohort, a large prospective multicenter study of patients with acute coronary syndromes in Switzerland. The study found that at 1 year, 27% of heart attack patients had persistent or new depression and 11% had improved depression. Patients with depression were less frequently married, had more diabetes, and were more frequent smokers. Smoking cessation had the strongest association with improvement of depression. Higher physical activity were also more prone to improve their depression. Heart attack patients should stop smoking and to be physically active. They should do moderate to vigorous aerobic exercise for 30 minutes at least 3 times a week, to be within recommended levels. This level of physical activity is good for your mental and physical health. Make sure you are working hard enough to break out in a sweat. Thank you.